Hey guys, my name is Dr. Rufi and you are welcome back to my channel. And of course, you know that this channel is no judgment zone, and as long as you're sexually active, make sure that you always subscribe, click, watch, tell your friends to come and watch. At least it's something that you know that you've done a good thing to yourself today, that you're able to, log into my channel and then get yourself well informed. We are going to discuss everything about sex. There's no limit in this particular channel. Our topic today is, reasons why women run away from sex. So before I jump into this topic, the question has been like, sister, I have this girlfriend and she don't want me to do wongle with that. Or my girlfriend is so stingy with her body and all that. At least with this particular episode, you know why sometimes she's like that, or it could be one of these reasons, it could not be one of these reasons. So let's just dive into it. I'm going to divide it into two broad, categories. The ones that are actually physiologically normal and the ones that are pathologic, which means disease conditions. So let's dive into the normal one. So one of the reasons is if the woman is menopausal. What do I mean by menopause? Once the woman clicks into menopause, the body has a way of telling itself, okay, I don't owe be that, or let me find a way to start, reducing all the secretions that are coming out. It's just hormonal, and let me reduce the secretions that are coming out from my punani. And then, as that happens, during sex, there's a lot of friction, and why some people don't feel pain is because they are well lubricated. So as you age, as you get into menopause, your body actually releasing lubricants is actually going to be very hard, and that's why menopausal women do not like sex, because they find it hard to lubricate that area for you to have a good time. The second one is most women run away from sex because of their period or premenstrual syndrome. What do I mean by premenstrual syndrome? These are symptoms that you get days before your period, and most times because of drop in the progesterone, which is a female hormone, they don't want to have any good time with their partner. Then the third one that is actually very normal is once a woman is emotionally disentangled from you, which means she's not emotionally attracted to you, she doesn't find you attractive, you don't catch her fancy, oh boy, forget it. She's not going to have a good time, and of course you won't have a good time. Then the fourth one is lack of foreplay. Of course. I can never ever bro, come close. Bro, you have to give her a good time. You just have to give her a good time, for crying out loud. If you want that place well lubricated, my dear, you have to,
you have to go down there well. You have to show her skills, not just down there. You can also give her some good time. Fondle with her breast. Do something, that tickles her fancy. And you see, naturally, God has put a lot of glands, oil making things inside that place. And you see, that place will start getting water, and you can now do your wongle. You get. So
a lot of women, when they're under so much stress and tension and anxiety, just somebody that is emotionally not available. When I mean emotionally not available, the person is emotionally tensed up, maybe at work or family issues, financial issues. Those are things that can tense women up, and then eventually they will not be readily available for sex. Another important thing that in our society we don't like talking about it. Crying by guilt is another big reason why women, avoid sex. So where I come from, actually, the third world countries, you're meant to believe that at a certain age as a woman, you're not supposed to have any sexual relationship with anybody. And most of our mothers do this by actually telling these younger ones scary stories about sex, all in the bid to try to dissuade them from having sex at a particular age. Some children deal with it with guilt. So if you have been taught all this all your life, even as an adult, even as a newly married couple, you're going to try to remove, that I call it that infringement, because that inhibition, you've already mastered it in your brain. In the brain, okay, so part of the brain that deals with inhibition is the cortex. So if you've already told yourself in the frontal lobe, okay, I'm supposed to hold myself till marriage. Most times when you're married, you see yourself still trying to tell yourself, I'm supposed to hold myself, then all of a sudden you're like, oh, it's true, yeah, I'm married, okay, let me try and relax. So within that period, you see, some women don't really know how to relax and let go of that inhibition center. So they keep holding on to that inhibition center, and then at the long run, you see that, why is there anytime I try to touch my wife, she's not in the mood, or she'll tell me, wait, then she'll now change her mind later on. Some of them is just this cultural imbibed guilt inhibition thing that has really gone on in their brain for a very long time, that's actually preventing them from relaxing and enjoying sexual intercourse. And then we're now going to head over towards the pathological, that's disease conditions that can cause women not to have good time in sex, and they will now be running away from sex. Number one is vaginismus. I know some people are like, what is that? I've never heard of that before. My dear, chill, let me give you the cocoa. Vaginismus, the vagina has muscles. So normally what happens during sex is, the vagina will be contracting and all that with the entrance and all that. So normally a penetration of the male stump, the male dogu, once it's penetrating your female punani, if you're relaxed, you have a very good time. But some people have problems with relaxing those vaginal muscles. It's not like it's not in their control. It's more like involuntary. And if you have that kind of problem, it's what we call vaginismus. So your vaginal muscles are not well relaxed. They're contracted. Someday I will discuss about vaginismus. But this is just like an overview of what vaginismus is. That is this condition that can cause you to like have low sex drive as a woman, is having what we call vaginitis. Vaginitis, that's inflammation of the vagina area, vulvar vagina area. This can be caused by high, when that place is very, very densely packed with candida infection. Or more, you could get vaginitis tired. They tell you, there's no way you can enjoy it because the whole place is inflamed and the whole place is painful and all that. If somebody just hitting you there, you're just screaming and you're not enjoying it. And the man is not also enjoying it. Except, some men are into BDSM and all that. So you're into that kind of freaky thing, yeah, it might turn you on. But if you're not, it's not going to turn you on. So another reason why women don't enjoy sex is also, this is related to the previous one, sexually transmitted diseases. What am I talking about? Gonorrhea, chlamydia, it causes what we call cervicitis. Cervicitis is like when your cervix, as a woman, there's something inside that, as they do it, that, and you be having that sensation, that thing that you're hearing, is your cervix that they're hitting. So that thing, if it's inflamed there, my dear, if it's inflamed because of sexually transmitted infections, you won't want anybody there. That lady will not, you're bringing it close, she's running for her life, but she doesn't want anything to do with it. The reason why women run away from sex, still under pathological, is when a woman has female genital mutilation. I don't know if you've heard about it. It's just, big grammar. Let me cut it short. Female genital mutilation is, a lot of our mothers, our grandmothers did that to the female child, but they didn't know that it was wrong. Female genital mutilation is just, in my place we call it EB, but like it's just circumcision, doing circumcisional acts on a female. So most cultures in Nigeria have this cultural thing that comes with a woman is not supposed to be promiscuous. A woman is not supposed to enjoy sex. A woman is supposed to have just one person that they are going to, have sex with all their life. So what some grandmothers or some mothers do is that in order to prevent, they go the extra mile to try to prevent their female child from having sex or enjoying sex. They cut off the normal female anatomy. Some people cut off the clitoris, some people cut off the labia. Be surprised at what people do. Some even stitch the whole vulva area, my dear. Kind of mutilation, you wouldn't enjoy sex because of the pain that comes with it, especially if you have the severe type of female genital mutilation, because the whole place is so stitched up that they allow just a little vagina opening. When the woman has come of age to, start having sex based on their cultural belief, they now try to open up a small hole where you can allow menstrual flow. Then the husband should be able to know how to open up the whole place whenever he comes in. But most times these women present to the hospital so that we can help them out to open up the whole place so that they can really enjoy their bodies. So a woman that is undergone such thing, you don't expect her to enjoy sex. She will find sex painful. There won't be any pleasure coming from sex, so she would actually avoid it completely. Another reason that post-evacuation depression. Okay, so let me just break it down. Post-evacuation depression is, after a miscarriage, a lot of women at least have undergone miscarriage one time in their life, or has had an abortion one time in their life. If you think, I know people are going to abortion, God forbid, my dear. If you check, a lot of women have done this, and I'm not here to be judgmental or anything. I am not here to judge you, but I'm just trying to let you know that yes, there's something called post-evacuation depression. When these women have undergone this miscarriage, or when they've undergone this abortion, whether with pills or with surgical mechanism or surgical methods or evacuation method, after that there's this depression that comes with, there's this guilt, number one, there's this depression that comes with it, and then they try to segregate themselves from their partners, and they try to question their belief, they try to question their sanity. Then for those that actually outrightly quite religious, they become secluded, and then they start questioning themselves if it's what they still believe in, if they still believe in God and all that. During all that process, you find out that they're not disposed to having sex with you. They're not going to have sex with you. People will be like, this one is for people that are not married. No, even those that are married, most married women actually do undergo miscarriages, and also they can also go for a termination of pregnancy it's all dependent on them. It's their bodies, and they should be able to do whatever they want to do with it. So most married women, after they've undergone that, they're like, oh no, I don't want to go to my husband, I don't want to start having sex because I don't feel it. I'm having that lack of energy, I'm having that loss of interest, I'm having that loss of appetite. So I'm not in the mood for sex right now. It's not the same sex that puts me in this kind of condition. I want me to go back to it. So it's post-evacuation depression. They don't want to have anything to do with you at that particular time. Last one that we'll be talking about is puerperal blues or postpartum blues. When a woman had given birth and her hormones are trying to come back to normal, her pregnancy hormones are trying to wane down, her normal hormones are trying to come up and everything. So a lot of women go through a lot of crying and have sex at that particular time. I understand that you might be tried, you waited, and you feel like, okay, I really need to have some, donko, if you're and you feel she's not ready, and of course she's not ready because she's not emotionally available, she's depressed and everything. So if she's undergoing all that, just her some time. She would come around. And remember, if it doesn't stop, always remember to visit the nearest, or your doctor, your gynecologist, your obstetrician. Make sure you visit them so that adequate management can be done. So that is all we have for today. Yay! So we're done for today's topic. And make sure you follow me on my next episode. It's going to be the next episode is just going to be how to circumvent all these problems. Yes, I've told you all the problems, things that cause women to avoid sex. So the next episode will be, how do we solve these problems so that our women can have sweet sex, so that our men can have sweet sex and they can enjoy themselves adequately and everybody's happy, So that will be the next episode. So make sure you stick around. Don't go anywhere. Make sure you press the like button, please. Just subscribe, like, call your friends so that they can also come and watch, learn, and also subscribe to the channel. Thank you so much for your patience, and I'll be seeing you next time. So see you guys. Thank you for watching. Make sure you like, make sure you subscribe. See you next time.